class, and welcome to today's adventure in dissection. We're going to be working on this video and probably some subsequent videos on the pig heart. And what you'll find is that usually when you get them, they'll either come individually wrapped, like so, or in a bulk bag. Either way we do it, what you want to do is make your cut in order to open this up as close to the vacuum seal as possible so that you can seal it back up should we need to go beyond a single class and not have it start to break down too much. So that's how you'll see it. For my class, usually this is one of the first dissections we're getting to, and after seeing all the pictures, usually the actual specimen is a little hard to deal with. So this is what you might see, or probably will see. This one's actually been cleaned up a good bit. I was able to get rid of some of the extra fat and tissue that usually comes with them. And what you'll see, I'll show you another one that hasn't been. You'll see the heart structure itself, the main muscle is pretty well clean. But once you get up where all the vessels are, it gets kind of messy and hard to identify things. So we will, depending on time and the condition that the heart is in, we may need to do a little bit of cleaning up, or if not so bad, we can move along without. So hopefully you can identify some of these things. So let's start with the external anatomy of the heart, or the things that you're going to see externally. And as you look through your structure list that was provided, you'll notice a couple of things. So the heart sits within the thoracic cavity, and as we've discussed in class, you have the four chambers. And most of the illustrations that we've either looked at or you've found online or in a textbook usually show a very equal distribution of atria and ventricles, which actually isn't the case. So what we have here is most of what you're seeing are the ventricular cavities. And up here at the top, you have what kind of look like ear flaps, if you will, also known as auricles. These are the atria. So you have them sitting up at the top. One of them sits a little further around behind, and sometimes they're kind of packaged in based on the vacuum seal from the packaging. It may take a little bit of movement in order for them to free up. Okay, but a lot of the blood flow that's coming into them is passive, and there's just a little bit of a contraction to help it along into the ventricles. Okay, so right down the middle you'll see a diagonal line, and this is the coronary artery as it serves the heart tissue, and you'll be able to see the branches as they come off. It also is going to divide your right and left side. So over here, your major ventricle, the left ventricle, the one serving or sending blood out to the body, is a little bit larger, as we've talked about in class, and we'll see once we cut into this the variation in size of our thickness of the wall. The septum is going to run right here along with the coronary, and then up here is your right atrium. Sorry, excuse me, right ventricle. I'm sitting on top of each left ventricle. You have the left atria. The right ventricle is the right atrium. Now, as we look at the vessels, and as I mentioned, this is fairly cleaned up, you'll start to see, and usually it's easier if you flip it over and look from the back, you'll start to see holes. And there are, based on how they cut these out, there are holes all over the place. So these are your major vessels coming into the heart and leaving the heart. And upon first glance, it's somewhat hard to figure out exactly where they're going. My recommendation, in order to identify them externally, they're usually pretty easy to identify internally, but from an external standpoint, usually suggest you either use your probe and sort of stick a probe down into the vessel and see if you can figure out where it's going. Sometimes that can be a little hard because you run into heart wall, muscular wall, and you can't really feel exactly where it's going. My recommendation, and actually the preferred method for me, is just to slide a finger down through the vessel and follow where it goes. Some of them are fairly deep. If it's long enough, it might be hard to do so, but usually you can figure out where it goes. All right, especially with the atria, your cavities are very easily, you can see pretty much where your finger is going, and you can move that wall around a little bit on each side. Okay. Now once you've done that, we can take a look at flow as to where blood is going. So we're going to start coming back from the body after it is delivered its oxygen and its nutrients, and it's coming back and needs to get to the lungs. So it comes from the upper body or front of the body of a pig through the superior vena cava, and the lower body or back of the body in pigs would be the inferior vena cava. So what we can do is we can find that right atrium. See if you can find some holes that are leading into it. So there's one here, and there's actually one down here. Okay. Now this is where one of the variations between pig hearts and human hearts comes in. You'll find that they come in at a 90-degree angle, whereas in humans they come in at a 180-degree angle. So if you follow those, I can actually stick my finger all the way through from the superior to the inferior vena cava. All right, and I can follow those into the right atrium. Now from there, they're going to go from the right atrium through the tricuspid valve, which we'll see once we get into the internal structures, into the right ventricle. From there, they're going to pump it out through the pulmonary valve into the pulmonary trunk. And this one sits right in front, so it's a little easier to identify. Now, the interesting thing about this particular specimen is that they cut the vessels far enough back that you can actually see where the branch occurs. So the trunk separates, divides and goes to the right and left lungs into the pulmonary arteries. And this one you can actually see both. Okay, so there's one hole here, one hole there. And as you look at these veins, you'll see that the vein walls are actually quite thin because our pressure here is not as high as it is in the arterial system. So if I were to follow this back down, you would see, get a different angle there, you would see that if this follows back the pulmonary trunk into the right ventricle. Okay? Once it branches off, goes to the lungs, it's going to come back in the back of the heart into the left atrium. The left atrium, actually in pigs, only has two pulmonary veins coming in, and oftentimes they're cut so close to that atrium that you can't see the separation. But you can see that this is where the oxygenated blood would come back from the lungs into the left atrium. It would follow down in this particular specimen, I can get down through that mitral valve or bicuspid valve into the left ventricle. Now that left ventricle is going to then pump all the blood out into the aorta. Okay, the aorta is here, and you can usually tell this because of the thickness of the walls. This is where most of your pressure is going to be from the force of the contraction, and for that reason this wall is much thicker to allow it to expand and accept that pressure. So it is going to come out there, go down to the lower body, but you also see two branches. Okay. Now this is another variation between pig hearts and human hearts, and you'll see this in cats as well, is that pigs and cats only have two branches off of the aorta. So you have the brachiocephalic, which is going to go to the head and the neck, it is going to go up and it'll actually branch into 3 branches. So your first branch will be your right subclavian, and then you have your 2 common carotids. Your other branch over here, your second one, this is the left subclavian, and this is going to serve the upper limb. So, in humans, you'd have 3 branches off of the aorta. You have the brachiocephalic, left common carotid, and left subclavian. All right. So there is one slight variation. From there, it will go out to the body. It will circulate around, deliver oxygen and nutrients, and then come back into the left atrium. Okay. So, just a quick review. We have our left ventricle, right ventricle, left atrium, right atrium. We have our pulmonary trunk that divides into the pulmonary arteries. You have your aorta that splits into the 2 branches off of that. On the back, you have your superior and inferior vena cavas, and you also have your pulmonary veins coming back from the lungs.